All right. Welcome to the webinar today, everybody. My name's Kate. I'm a program manager with the Institute, and I want to welcome you to an overview of the Patient-Centered Primary Care Home, or PCPCH program. This is the third webinar that we've done this week in honor of National Primary Care Week. So we are in the home stretch, and thanks to those of you who've joined us the past 2 days for the previous webinars. If you missed those, they are available online on the Institute website. So before we get too far along, we would love to get your questions throughout the presentation today. There is time reserved at the end of the webinar for Q&A. Everybody is on mute, though, since we have people on a lot of people on the line and more people coming. Everybody is on mute, but we do still want your questions. So type those in as they come to you during the presentation. That way I can organize them and ask them to our presenter when Q&A time comes. Sorry for the ambient siren noise. We're in downtown, so it's going to just get a little bit louder, and then it'll get quieter in just a moment. So again, go ahead and type those questions in as you have them. The one question I can anticipate always is about the slides, and those will be available on the Institute website later today, along with a recording of this presentation. So if you have colleagues who've missed it, they will be able to get caught up that way. This webinar is hosted by the Patient-Centered Primary Care Institute, which is a partnership with OHA to get technical assistance, information, and resources out to folks working on the PCPCH model, which Nicole is going to talk about in more detail today. You can access Institute resources via our website. So there are a series of online learning modules where you can learn even more about the individual PCPCH standards in a much deeper level than what Nicole is going to go through today. There are recordings from previous webinars. We surely have got to be past 20 at this point on a variety of topics related to primary care transformation. And you can sign up for our email newsletter, and that's where you'll get updates when there are new things added online. We feature resources, we link to blog posts, and also announce any in-person or other training opportunities available through the Institute. So we definitely encourage you to encourage your colleagues to register for that list as well, to stay on top of what's going on at the Institute. I am pleased to introduce Nicole as our presenter today. She is responsible for oversight of the OHA PCPCH program. The goal of the program is to develop strategies to identify and measure patient-centered primary care homes, promote their development, and encourage all Oregonians, particularly those populations covered by OHA, to receive care in this model. Prior to her current position, she was director of the Oregon Medicaid Advisory Committee, a federally mandated body charged with advising the legislature and OHA on the operation of Oregon's Medicaid program. Even before that, she worked as a program development analyst for the Oregon Public Employees Benefits Board and a research assistant at OHSU. She has a bachelor's degree in biochemistry and molecular biology and a master's degree in public health. Thank you for joining us, Nicole. I'll turn things over to you to talk about the learning objectives for the webinar.
Okay, thank you so much, Kate, and good afternoon, and happy National Primary Care Week to everyone. I really want to thank you for joining us over your lunch hour too, and hope I can provide at least a little bit of entertainment as you enjoy your lunch. So the main objective of our webinar today really is to connect with and provide some information to clinics and other stakeholders who aren't yet familiar with the program. So much of the information provided today may be a review for those of you who have been engaged with us over the past couple years, but for those of you who are new to the program, I'd just like to say welcome again and thank you for joining. So today I am hoping to gain, that those joining us will gain a broad understanding of the PCPCH program, and also to receive a little bit of information on who these clinics are, really what they look like, some data about their staffing, and to get some information on some of the perceptions of the model from some surveys we've conducted over the past couple of years, as well as an understanding of sort of our direction and priorities for the program in the upcoming year or two. So to begin, a little bit of background on the program. House Bill 2009 allowed the OHA to step forward in its plans for delivery system reform, and really as a first concrete step created the Patient-Centered Primary Care Home, or PCPCH program. PCPCHs are Oregon's definition of a medical home and are the primary care delivery model that is at the heart of Oregon's broader transformation efforts. The key functions of the program are to recognize and verify clinics that are meeting the standards under the model, to refine and evaluate those standards over time, and to develop some technical assistance as well as communication and provider engagement opportunities. Under the program, the goals are that all Oregon Health Authority covered lives, so that includes Medicaid, the public employees, and the Oregon educators, receive care through a PCPCH, and as well that 75% of all Oregonians have access to a PCPCH by 2015. We're also working to align primary care transformation efforts by spreading the model to payers outside of the Oregon Health Authority, such as those in commercial health plans. So in terms of the broader health system transformation efforts that many of you may have heard of, a lot of people will ask, okay, well, how do primary care homes or PCPCHs fit into that picture? Well, Oregon's broader health system transformation efforts include implementation of coordinated care organizations, or CCOs. And this model replaces Oregon's Medicaid managed care system, under which the state contracted with separate managed care organizations for physical, behavioral, and dental care services. Whereas CCOs are now responsible for integration and coordination of all of the members' benefits and services, PCPCHs are really the model of primary care delivery that's at the heart of each of those CCOs. Key components of the overall CCO model, just for a very quick review, include local accountability for health and resource allocation, standards for safe and effective care. CCOs must report on 33 metrics across 7 quality improvement areas. A global budget indexed to sustainable growth, so that CCOs are given flexibility to allocate resources for each member in a way that best fits those needs for any of the services or benefits that they need. And then another key component of a CCO is the use of the patient-centered primary care home model, again, as the basis for its primary care delivery system. CCOs are required to use PCPCHs recognized by the OHA to the greatest extent possible in their networks. So the rest of this talk will really focus on the components of the PCPCH model and the program within the OHA responsible for its adoption across the primary care system. The model is defined by 6 core attributes, as you can see pictured here, each with a number of corresponding standards and measures. Within the model, there really is quite a bit of flexibility to receive credit, if you will, for the good things that clinics are doing that are important for their specific patient populations while not getting dinged for those things that may not be applicable to that population. And I'll talk a little bit more about that in a second. After House Bill 2009 established the program, the OHA convened the first Standards Advisory Committee to develop what a primary care home would look like in Oregon. They looked to other national and state models and felt that while each of these models had some good components, it didn't accurately reflect what all of the stakeholders felt true patient-centered care should look like in Oregon. It should be noted that one of the key purposes for convening the group and developing the Oregon PCPH model was so there could be one set of standards that could be used across stakeholders and payers for defining this kind of care, as opposed to having a myriad of, quote, medical home models or programs. The committee developed a model defined by the 6 core attributes that you saw on the previous slide, again, each with a number of corresponding standards and measures. It's a tiered model similar to the National Committee for Quality Assurance patient-centered medical home model that some of you may be familiar with Tier 1 having foundational structure and processes in place, and Tier 3 being a more robust patient-centered primary care home that can very proactively manage their patient populations. Getting a little bit more in depth, there are 10 must-pass requirements that each clinic must meet in order to become recognized as a PCPCH. Outside of these, clinics are free to choose from a menu of measures that fall under the core attributes that were shown on the previous slide. And that is really where the flexibility of the model that I was speaking to comes into play, given that the clinic can sort of tailor that menu of measures that they attest to, dependent upon which ones they feel are most applicable and meaningful to their patient populations. So I'm not going to go through each of these 10 must-pass requirements in detail. They're really just for your reference later, but one important thing to note is that clinics don't need to have an electronic health record to meet the must-pass requirements and become recognized. That is one question that we often get. There is an assumption made that clinics do have to be actively using an EHR in order to get recognized. That said, while you don't have to have one, there are certainly some measures that would be easier for clinics to meet if they did have the opportunity to work with an electronic health record. And it's not that we're discouraging the use of those, but it is not included on the must-pass requirements. So for those of you who aren't familiar with our application process, there are a couple of steps that we highly recommend taking before filling out an application for recognition. So as a first step, please review the technical assistance guidelines that are available on our website. This document describes exactly what a clinic needs to have in place to meet the intent of each standard, as well as examples of what does and does not meet the intent. Secondly, it's a good idea to complete the self-assessment tool. Again, it's available on the website in preparation for your application. This will allow you to see which measures your clinic is likely meeting and also allow the opportunity for you to collect and save all of the data and supporting documentation for each standard. We don't require that the supporting documentation is submitted at the time of application. However, it is information that we would be asking for at the time of the site visit if one were conducted to your clinic, and I will talk about those in a second. Lastly, you can access and complete the recognition application online. Once it's submitted, staff will review the applications, and typically a clinic should receive a response within 4 weeks. So as I mentioned, as a piece of the recognition process, we conduct site visits to a random sample of clinics that have been recognized. And the goals of that process really are a verification that the clinic is actually doing basically the things that they attested to on their application, and that application accurately reflects their practice. An assessment of how the care delivery and team transformation process to understand the intent of that model is actually integrated into the qualities and services of the PCPCH. And really importantly, it's an opportunity for some collaboration to identify the needs, barriers, and any areas of improvement to help clinics establish improvement plans and to connect clinics with some technical assistance that is available both through the Patient-Centered Primary Care Institute as well as our own in-house technical assistants and staff that I'll talk about a little bit later on in this presentation. We have 2 teams that conduct the site visits that include 2 PCPCH program staff and 1 clinical transformation consultant who, in most instances, is actually a practicing clinician from the same region as the clinic being visited. And they really are a clinical champion who has gone through this practice transformation process and can really speak from a firsthand experience about some of the challenges that they encountered when making this transition in their practices, and also help other clinicians identify some tools that can be used for overcoming some of those barriers and challenges. I don't really want to go into too much detail about the site visits, but I do want to emphasize that we're very committed to making the visit a collaborative process that provides the clinic with technical assistance and support to the extent they need and or want it. The site visit teams include staff that have backgrounds in practice coaching and quality improvement, and their role really is to help clinics meet their transformation goals. And I can't say enough about the great teams that we have and we've been fortunate enough to bring on board. I do think that they're absolutely wonderful and a great resource to all of you. And we do have a webinar that for those who weren't able to attend yesterday, We do have a webinar that goes into much more detail on what to expect at a site visit, and that is available on the Institute website now. So if you want more details about what to expect and what that process is like, please visit the website and take a look at that webinar. So now I'm going to switch to describing a little bit of what we know about recognized clinics. And I think that what you'll see is that there isn't a, quote, typical PCPCH in terms of size and location, and that if you are someone who's listening in that's in a practice that is currently unrecognized, there are likely many clinics that resemble yours that are participating in the program. I think that folks have a tendency to assume that we have only been working with very large and or technically advanced practices that are all in urban areas, and that is actually far from the truth. So we currently have over 500 recognized clinics throughout the state, and actually just a couple right over the border in our neighboring states. About 35% are located in areas that are considered to be rural, and about 65% are located in areas considered to be urban. But again, that urban category spans anywhere from what we call urban small, which are kind of bordering rural areas or much more suburban actually, to very urban large locations that are more like the Portland metro area. The recognized primary care homes, as I said, represent a wide variety of practice types and structures. And here are some quick facts on who these clinics are and what they look like. We know that there's about an average of 5 providers in each clinic. The majority serve adult and pediatric populations as opposed to just one or the other. There are a small but growing number of clinics that actually offer or provide complementary and alternative medicine. About half are owned by a larger system, but about 40% are actually independent and unaffiliated with any other sort of alliance or system. We also conducted a survey last year of all the recognized clinics at the time and found that over 80% of them needed to add at least one new service in order to meet the standards. And given the size and scope of the program, again, currently we have over 500, we think it's a really remarkable illustration of the ability and desire of these clinics to partner in the state's health system transformation goals. For the services that were implemented, most frequently it was related to tracking patients admitted to or discharged from a hospital or referred to a specialist, as well as creation of care management teams for defined panels of patients. So for example, those with chronic conditions or high utilizers. These next 2 slides are meant to illustrate the range of PCPCH implementation that exists across all of the practices that are recognized, as well as to show that the ability and capacity for each clinic to meet the PCPCH standards doesn't widely vary by practice location or size. We often hear that small and rural practices are unable to meet the model. And we had known somewhat anecdotally before that that wasn't true because in just working with some of the clinics who were participating in the program, we knew that there really were some exemplary practices that were both small and rural or both. But now we actually have some data showing that this isn't true as well. I do want to note that the scores on that left-hand side don't represent a total application score, so I don't want folks to get confused there, but it does correspond to the number of measures that the clinic attested to on their application. So again, this is primarily to show that within each geographic category, so from left to right, you're looking at rural, urban small, urban medium, and urban large, those 4 different categories that we have divided folks into. That there is wide variation within each of those categories in terms of an individual clinic's ability to meet the standards, and it exists across all those categories, but also that the average isn't markedly different across each category. So again, I think it just goes to show that folks that are located in more rural areas of the state really are well equipped to meet the standards, just as those that are in some of the metropolitan areas. And again, this graph illustrates a similar concept as the previous one. However, this depicts the variation in average scores by clinic size as determined by provider FTE. Also, as you can see, while we do have a number of very large clinics that you have on the right-hand side there, those with 10 or more full-time equivalent providers. We also have a very large number of solo provider and small clinic participation, as you can see on the left to middle. It kind of spans about half of the graph, actually, that only have 0 to 2 full-time equivalent providers. And again, you can see that there's wide variation within each of these categories, but that really the average does not vary widely within each of those. Through some of our survey work, as well as an analysis that's conducted by the Oregon Healthcare Quality Corporation, we found that 85% of recognized clinics feel the model is helping their practice increase the quality of care, and also that the recognized primary care homes demonstrated significantly higher mean scores than non-recognized clinics on a variety of indicators. We also wanted to assess clinic perceptions and found that 75% feel the model is helping their practice increase access to services, and over anywhere between 82 to 85% of those surveyed believe the model is helping them improve the individual experience of care as well as improve their population health management. Very quickly, I also wanted to note that 97%, so almost all of the independent or unaffiliated practices responded that PCPCH implementation helped them to improve population health management. So we didn't ask any kind of follow-up questions, but we believe that this might be that independent practices are in greater need of this kind of roadmap to help them transform their practices as compared to their counterparts in larger systems or those affiliated with other associations who may have some of that support and roadmap actually already just built into the way their organization is structured. We've also begun to look at impact of the model on cost and utilization, and we compared service utilization at recognized PCPCHs to non-PCPCH clinic sites before and after implementation, and found that PCPCH recognized clinics had significantly more preventive procedures and significantly less specialty visits and pharmacy claims than non-recognized clinics. As well, the PCPCH sites also had lower emergency department use, but it didn't reach a level of statistical significance. We also ran a similar comparison but looked at expenditures as opposed to just utilization, and found that the PCPCH recognized sites had a significant decrease in costs associated with primary care visits and specialty office visits. I definitely want to mention that for this kind of analysis, we were looking at a relatively small time frame, so only from 2010 to 2012, or 1 year post-program implementation, and that in many cases the kinds of reductions that we believe might be associated with this model may take 2 or more years post-implementation to occur. So again, the initial trends that we are seeing here, we do believe are very positive. So we definitely know that there are challenges in meeting the standards, which is why one important component of our program is providing technical assistance to clinics. So what do the clinics still need? These probably aren't a big surprise to you. But we've heard that the most commonly reported barriers are cost and lack of resources, staffing and training, time, and administrative burden and reporting. And the most requested areas for future assistance are in the categories you can see there, anywhere from patient and family engagement to team-based care and empanelment. And those are many of the topics that you'll actually see with tools and resources available on the PCPCI website. So very quickly, because I want to try to leave at least a few minutes for some questions. We do believe that we have taken an interesting approach, an engagement model approach, and been able to affect change on a large scale through reaching a large number of clinics, and we really do want to continue to maintain those relationships in the upcoming year. But we're also looking to engage the clinics who are currently unrecognized, and we'll be hoping to do that through a variety of ways, including partnering with other organizations and stakeholders who are also looking to make those connections as well. As I mentioned earlier, we have expanded our focus on technical assistance through some of the staff and practice facilitators that we've been able to bring on board. So I would say if that's something you're interested in, please feel free to reach out and inquire a little bit more about that. And we're also in the process of developing a special designation for those practices who are truly the leaders in practice transformation and have implemented a number of advanced primary care home features. We're calling it the 3-star designation and have been developing the criteria in conjunction with feedback we've received from several clinics and other stakeholders. We are hoping to open up the criteria for public comment within the next few weeks, so we'll be circulating messages to folks letting you know as soon as that happens. Just a couple notes on that. That designation is completely tied to the PCPCH standards and models, so there's nothing outside of the measures that are currently in the PCPCH model that you would see there. So I don't want anyone to get nervous about that. And it also won't cause anyone who's currently recognized to basically lose any of their current status. This is just something that is really above and beyond to really identify those who are leaders in this field based on some of the criteria in the current PCPCH model. So lastly, I just want to be sure to mention that we have a great resource available online on the PCPCI website that does a much deeper dive, Kate mentioned this, into each piece of the model. So those are the online learning modules that are a great resource for clinics who are new to the program or just have new staff that you've brought on board, or anyone who wants to gain a deeper understanding of the intent of each measure. They take about 2 hours to complete the entire training, but there is CME and CE credit available for those who complete the entire set. So again, I want to thank everyone for taking the time to join us today, and I hope that I've left at least a few minutes for some questions.
All right. Hi, this is Kate again. Again, you can submit questions for Nicole to answer using the questions pane on your GoToWebinar control panel. So there was a question, one of the ones that came in, is it possible to get a list of unrecognized clinics? So as people are sort of doing outreach,
Right.
is there, you know, trying to get...
That is actually one thing that we are working on developing right now. So the quick answer is no, such a comprehensive list does not exist. There are a few different resources and organizations that we're currently working with to try to fill in some of those gaps, to try to figure out who is unrecognized. But there isn't a comprehensive clinic directory that exists that lists just, you know, here's every clinic in the state. So we're working on creating one, and that will be something that we'll be looking to, again, partner with different groups on to really develop some good outreach strategies. So if there's anybody on the webinar also that thinks they maybe have some good ideas for resources and how to partner with us in creating this, again, please reach out to us and let us know.
Yeah, and I'll be sure to connect the person who answered or who asked this question with you via email so you can follow up as efforts to locate those unrecognized clinics move forward. If there are any other questions, let's have them in the GoToWebinar questions pane. I did get one about, yes, the slides are available on the Institute website and a recording will be up by the end of today. And same for the site visit webinar that took place yesterday. It was a full hour and goes into great detail on the site visit process for the PCPCH program. And that recording is already up and available on the Institute website. Let's see. Let me check and see if there are any more questions. And I think that might be it, but that might be handy enough since we are at pretty much 12:30 and that was when we were scheduled to end. Oh, there was one that came in. Maybe we have time to just get this last one, Nicole. Of the 80% of clinics that need to add new services, can you speak at all to what kind of services they're needing to add?
Yeah, you know, I could, as I mentioned before, there were a whole list of them, and I could actually maybe, Kate, we can figure out how to get that list out to folks. The most frequently added services were around tracking patients who were admitted to or discharged from a hospital or referred to a specialist, so really around the communication that's involved in care coordination when the patient is being seen outside of the primary care site, as well as the creation of care management teams to focus on specific populations for folks and really proactively manage their care. From there, I think you know, it ranged across all of the standards. So maybe, Kate, that's something that I can just pass that list off to you, and you could circulate it around to the attendees so they can take a look at that.
Yeah, absolutely. We will follow up with that via email. So if any other questions come in, we will follow up with those via email, but we are at 12:30, so we're going to go ahead and end the webinar. Here are some of the resources, so the PCPCH website, primarycarehome.org and .gov, the Institute website, pcpci.org, which is where you can find those online learning modules. And please do take a minute to take the post-webinar survey that will come up as you exit the webinar today. The feedback that we get to those surveys helps us plan webinars in the future. I want to thank Nicole for coming and sharing information today, and hope everybody has a great rest of the afternoon.